Jillian. So listen, today we are going over to visit my doctor. His name is Dr. Odueke. He is the head of Obstetrics and Gynecology. So he delivers babies and he also does surgery. Today we're going to ask him about fibroids and hysterectomy because we want to know about them things as women, right? What exactly is a fibroid? What is a hysterectomy? Among a couple of other questions I'm going to ask him. So stay tuned because this is going to be a real thing. Thank you for seeing me today, and I just want to get some information out.
Good afternoon, Jillian. It's nice seeing you. Yes. It's nice to see that you're doing well.
Because of you.
You're looking well.
Thank you very much.
As you know, my main forte is looking after women, be having babies or dealing with gynecological problems.
Right. So now how you dealt with me, we're going to just keep it specific as to fibroids and hysterectomy. So first of all, Dr. O, I'm going to call him Dr. O. What is a fibroid?
Fibroids is actually, it is a benign, non-cancerous growth on the wall of the uterus. This is 3 to 4 times more commoner in black compared to Caucasians or Asians. What causes fibroids? We don't really know. Nobody knows. But most people that have fibroids don't even know they have it. How do we find out that the people have fibroids? Either they have an ultrasound performed, maybe a routine ultrasound for checkup, and they find out, oh, by the way, there's a fibroid.
Right.
Or some patients will present with symptoms of a fibroid. Commonly, the most common presentation is very heavy periods.
Okay.
Heavy, painful periods. And fibroids varies in sizes when we do ultrasound to see them. The fibroids could be as small as a pea, as the size of a pea or a peanut, or it could be as big as the size of a soccer ball. The way it presents when it's going to cause trouble doesn't depend on the size of the fibroid. You can have a very small fibroid and with a lot of symptoms like heavy periods, painful periods, and you can have a very large fibroid that's as big as a soccer ball with no symptoms. Also depends on the size of the woman. Some women can have a big soccer ball fibroid without actually knowing that they have something until they have an ultrasound done.
Wow. Dr. O, can a fibroid be felt outside of the uterus?
Yes, it could be felt after the uterus. As I said earlier, fibroid sizes varies from the size of a peanut to the size of a soccer ball. Okay. And the 3/4 size of your fist is the size of what we expect your womb to be. And that, when a woman is lying down on your bed, if you feel your tummy, you should not be able to feel your womb. If you can feel something hard above your pubic bone, there's a possibility of that you have a fibroid. Or if not a fibroid, there's a mass there that needs to be checked out, that you might need to have an ultrasound to check it out.
Okay, so in terms of a woman getting pregnant, would a fibroid be disruptive to pregnancy, or would it be hard to get pregnant with a fibroid?
Fibroid on its own does not necessarily prevent a woman from getting pregnant. As a matter of fact, a lot of fibroids, we find out that some women have fibroids while we are doing a cesarean section, for instance, that we found out for the first time that the woman has a fibroid, and the woman has never known before that she has a fibroid. Very rarely, in very big fibroids, there might be some slight reduction in chances of the woman getting pregnant. But if a woman has a large fibroid and gets pregnant, there could be that woman could have earlier miscarriage, or it could have premature labor, depending on the size of the fibroid. But in most cases, most pregnancy will go through to the end, up to 40 weeks, even with a fibroid.
Oh, wow. Some fibroids can cause many problems, and then it can lead to a possible hysterectomy after investigation. Is that correct?
Right. If a woman doesn't have any trouble with a fibroid, given that it's not cancerous, it's benign, if it's not causing any trouble, we don't need to do anything. But if a woman who has completed their family, typically in their 40s or middle 40s, have very heavy periods, periods that is, and they has a very large fibroids that is causing pressure symptoms on the bladder, that they have to go to the washroom many times because of the size of the fibroids. Some people have constipation as a result of a fibroid that is putting pressure on the bowel. If a woman is having those troubles and it's affecting their day-to-day life, among the treatment options is hysterectomy, which is usually the last resort. But there are many other options of treatment that could be done before that, provided they don't have contraindications to using birth control pills, for instance. We do offer birth control pills to help to reduce the blood flow. Not necessarily reducing the fibroids. The fibroids will probably remain the same. We could offer to do a DNC and do a procedure called endometrial ablation, which is burning the lining of the uterus to reduce the menstrual flow. That goes a long way to help. So that's another option. Right. Another option of treatment that we would consider before we offer hysterectomy is use of Mirena IUD. It's a form of a hormonal IUD, like a coil that was inserted in the woman's womb. This Mirena, when it's inserted into the womb, helps in reducing the menstrual flow as well. It doesn't make the fibroids shrink, but also helps in reducing the flow. So in a woman who has very heavy periods, if the woman can have the periods contained with either a hormonal treatment or with a DNC, they do not necessarily need to have hysterectomy. Right. But some women may not be helped with all these other options that I've discussed. We may then have to consider hysterectomy. And the hysterectomy we can do them in 2 or 3 ways. We can do it either abdominal hysterectomy, where we have to have a scar in your tummy, either a bikini incision that you use or an incision below your belly button, which is up and down. Or we can do the hysterectomy through a laparoscopic, which is a keyhole surgery, where we make tiny little incisions in your tummy and we're able to remove the uterus from down below. And the third route is to remove the womb itself vaginally, depending on the size of the uterus.
Right. And so within the hysterectomy, you're removing the uterus. Mm-hmm. And would you observe the ovaries as well to make sure that everything is okay there?
Absolutely.
So is it a partial hysterectomy that would be involved in fibroids, or a total hysterectomy?
Okay, I think it's a common question that patients do ask. I think the word partial hysterectomy in layman's term means just removing the uterus and leaving the ovaries there. Full hysterectomy in layman's term is removing the uterus as well as the ovaries. Okay. A partial hysterectomy, we tend to offer that to women who are younger, who are less than 50, 52 years of age, who are still having their periods, who still have estrogen, who are not in menopause yet. But if a woman, for instance, who is 60 years of age, comes to us and has a big uterus fibroid that is causing pressure symptoms, that is so big that maybe 2 soccer balls or 1 soccer ball that is affecting her significantly, in that case, we'll do a full hysterectomy where we remove the uterus and the ovaries. Because at menopause, as you know, the ovarian function has diminished almost gradually down to 0 by the age of 60.
Okay, that's great information. So we were specific on fibroids and hysterectomy today, and I want to thank Dr. O for explaining that to us, because, you know, we have a lot of women that are interested in this topic. So what I want to ask you, doctor, is just outside of the fibroid and hysterectomy is, what age should a young woman get a Pap smear at?
A Pap smear, a woman from the age of 21 should start having a Pap smear. Every 3 years we'll be having a Pap smear. And I do strongly recommend that women go for this, because cervical cancer, which is what we're trying to pick up with a Pap smear, it's something that can easily be prevented if a Pap smear is done regularly. It's been known now that the HPV virus accounts for about 70% to 80% of cervical cancer. This vaccination reduces the chances of women developing abnormal Pap smears that may, in later years, if not treated, lead to cancer. So I do recommend that young girls in high school at about grade 9 or grade 8 or thereabout, I do recommend you get their vaccination, and it's been offered in all public schools at the moment.
Okay, so Pap smears are very important, and the HPV vaccination is also very important.
Very important.
Well, that's very informative. I want to thank you for all of your answering all of our questions today.
You're welcome.
And I just have to say that Dr. O is from Nigeria, and I know that you love Nigerian food.
Yes, I do.
So, which one out of the 3 would be your favorite Nigerian food? And when would you eat Nigerian food? Usually on a Sunday, right?
I can eat it any day. There's no fixed time.
But I see this man running around the hospital, so I know that they don't have his type of food in the cafeteria. So what is your choice? The jollof rice? Am I saying this right? The egusi soup?
Yes.
Or the porridge yam?
I do eat all those 3, but my favorite is the jollof rice.
All right.
I like that a lot. As you know, I hardly have time to eat, but the little time that I have, I devour my food very much.
I thank you so much for having the time today to take care of us women with all this information. And in my best Nigerian accent, I am going to tell you, Nagodi.
Nagodi.
Right? Am I saying that right?
You're saying it right.
All right. So I'm ready to go Nigeria. Wow, thanks to Dr. Odueke. That was such a fun interview because you know what? He's so informative, and no matter what you go in to see this man about, he makes you feel so comfortable, whatever the situation is. He's so humble and kind, and you know what? He'll really take care of you in surgery as well. So if you liked the video, don't forget to thumbs up, subscribe, do all of that. And can't wait to see you the next time.